Please welcome Dr. Somil Nakwal, Senior Health Specialist of the World Bank. Thank you very much for your coming here and join this podcast. I actually very curious. Even we know each other for a long time, but how did you join the World Bank and then was placed in Jakarta?
Thank you very much, Pagopran. It's an absolute pleasure to be here, and thank you for hosting me. I joined the World Bank in 2009. Um, Before that, I was actually in the Indian Civil Service. I was a bureaucrat,
Right.
and my last role as part of that system was the health insurance regulator for India. But it was a very important lesson for me to be in an institution where I could also acquire a global perspective and work with many more countries and continue to be on my learning journey. And that attracted me a lot to the World Bank. And I think it is about 13 years now and going strong. One of my favorite assignments was to try and work in Indonesia.
Oh,
And
what made you more interested to work in Indonesia?
I think, Pa, there's been a lot of, first of all, I think we come from large countries. So there's first, the impact size is big. Anything that we are able to do together has fairly large impact. And as you know, success in Indonesia can mean success in the world's targets, right? So it's a very important country. Also, I have been very fascinated, partly thanks to my knowing you about the JKN. And I was very keen that we are able to, or I am able to work with you and with the JKN team a little more. And so it was, to me, in many ways, a dream come true that I was selected for being posted in the Indonesia office.
Thank you. I think this information is very important. And actually, we know each other in the JLN that time. So I think many viewers and listeners do not know actually the JLN. Can you little bit explain about the JLN, the mission, and how far now the achievement of the JLN?
Sure, Pa. Thank you very much. So, Pa, the JLN, or the Joint Learning Network for Universal Health Coverage, which you happen to be one of the founders of, the first meeting of the JLN was in 2010 in February, where you represented and led the Indonesia delegation, and you have been part of our steering group since then. The JLN is a unique platform. It is about countries being able to share their knowledge and learning with each other. We as development partners, whether it is us from the bank or there are many other partners like the Gates Foundation or the Rockefeller Foundation, we are in a facilitation role to make the connections and to be able to bring the country knowledge together. But it is built on the fundamental premise that there is a lot that is known much more by the country practitioners than we have been able to discover and document. And so it's a network that brings together the country practitioners to be able to, one, share what they already know so that the ones who are following a similar path can have their journey a bit smoother and a bit faster. But then it is also about jointly solving common problems.
Right.
So countries can come together, see the common challenge, and share their effort in solving the problem together. So that's what the network does. And from the 6 countries that joined originally in 2010, Pagofran, along with one of them being Indonesia, today it is a network of 34 countries, a country-led steering group. 12 countries are selected and represented on the steering group. You are, of course, on the global steering group and representing Indonesia, not only now, but I think right from the first steering group, you have been representing Indonesia. And like that, every 2 years, there are 12 countries selected to be on the steering group. So it is trying to make sure that the topic selection as well as the way of learning meets the country needs first and foremost. I think that's what also makes the platform very unique.
Right. Congratulations for the achievement and also the explanation. and how actually the relationship between JLN and the World Bank.
Thank you, Pa. Pa, the World Bank is one of the founding members of the Joint Learning Network and is also one of its key partners. We are very closely working, particularly at the country level, in being able to connect, using our global presence to connect our counterparts, our clients with the JLN. So people like me in country offices are able to connect to their counterparts and bring their knowledge to the JLN and take the JLN's knowledge to them. I am also representing the World Bank on the steering group of the JLN, and we are also facilitating on some of the technical areas. There are many other institutions also facilitating technical knowledge, but on health financing technical initiative, the World Bank is the technical facilitator as well.
Okay, thank you. I think World Bank and JLN also, lucky to have you join.
That's very kind of you to say, Pa.
Okay. And now we come to the Indonesian setting.
Sure, Pa.
So as you know that we have JKN-KIS program, which is around almost 10 years, but not yet. And what do you think about JKN-KIS program, the National Health Insurance Program? What is the things which is still lacking, and what is thing that may be on the right track, and what should be maintained, thing like that?
Thank you very much, Pa. So I must say that as I was mentioning, one of the first and foremost reasons why I have been so fascinated about Indonesia has been this massive reform that has been achieved in the form of JKN. Very few countries are able to create a single pool and a single pair, which is not only very equitable because it gives different, it does not split population groups into different pools. So this is very equitable, but also it can create a lot of leverage for the single payer in being able to improve the health system and have a cascading effect on the health system. So I think some of the design elements of Jaminan Kesehatan Nasional have been very well achieved with that single pool, where more than 300 risk pools were consolidated. It's not a small achievement, Pa. And I think we need to protect our single pool and single payer status well. That is a very good achievement we have. And the results are also there to see. For example, Pa, I was reading about your latest numbers, and I found that now our enrollment is 86% of Indonesia's population.
Yeah.
It was more than 80% in just 6 or 7 years of the existence of the program. Very few countries are also able to move that quickly into covering a majority of the population. And finally, I think this is where I should say, in English, the simile is the proof of the pudding is in the eating. What is the experience telling us? And I think one of the most significant changes that you can already see is an unprecedented decline in the out-of-pocket expenditure as a share of total health expenditure of Indonesia, which came down from about half of the total health expenditure being out of pocket, where people were directly paying to the pharmacy, to the doctor, to the diagnostic center, to less than 1/3 of the total expenditure in just about 5 years of JKN. So again, very few countries are able to create that much impact on the level of out-of-pocket spending. So there's a lot to be proud of, and I think we need to sustain that. But of course, there are things we have to improve.
Yes.
There is a second generation reform agenda, if I could say so, probably as significant as the original reform, which can now make JKN much more sustainable, much more impactful in how the health system performs. And I think those things should be now on our agenda. So a lot of that will be on building our capacity as a system, as a country, and being able to get more and more influence and impact and population health outcomes out of our spending plan.
Okay. Thank you. Of course, it is not easy. The next challenge, how to improve the health outcome of the populations, because there are many factors influence that. And of course, maybe we let you know that it is the first time in the history of BPJS Kesehatan where now we are surplus. This is not deficit. And of course, now we are focusing on how to increase the quality of care, not only quality of care in the hospital, but also in the administration. So, do you have any suggestion or what still lack and we should increase, and maybe we have, to develop to increase the quality of care in Indonesia?
Thank you very much, Pa. I think it's a very good point to be in. We all have waited for a point where the deficit was no longer there. I think this is now a good point to think how we sustain our sustainability even better. And one of the things, for example, is to look at creating appropriate reserves. For example, the pandemic has meant that utilization did have some impact in all the countries. People were delaying some procedures. So can we create reserves to account for some of the delayed care seeking, some of the maybe increased costs that will happen because of this increased care seeking, so that we don't feel the pinch a little later? So creating a system of good reserves and building reserves, like many other health insurance institutions do, would be I think a very useful step at this point of time. But this is also a point of time when we do not have any cash flow challenges to build some novel ways of helping the health system, but also making it stronger. So, for example, you've started the system of down payments, making advance payments. If those can be linked to hospitals that preferentially perform better on quality, for example, or making that a requirement, gives everybody an advantage. We get better quality, we get better results, and the cash flow status helps in that sense as well. It's also a good time to revisit our provider payments, to particularly look at primary care and how we can make it even more comprehensive, and how we can add performance elements to primary care and maybe add some more resources for that. So it's a very good place to be in, to be able to now look at this very complex, as you agree, second generation of reforms. But I'm very optimistic, because the first generation of reforms was even more complex, but Indonesia was able to do so. So I think the second one is more a technical solution, and I'm sure we will be able to do that as well.
Okay, I hope that the second generation of reform will be successful. As you mentioned, that it is, of course, difficult and have big challenge, but not as big as the first generation of the reformation. And now we are actually supporting the Ministry of Health in transforming primary healthcare functions, and also for the capacity building in the primary healthcare. Even some of the promotion preventions like screening, so we increasing. Now we are also doing screening, around 6 type of screening, like diabetes screening, cancer screening, hypertension, and so on and so forth, even diabetes mellitus. And in the coming years, we would like to increase to support Ministry of Health to be 14 type of screening. But of course, then this our challenge, because this will increase the cost for the first time, and maybe second time, or at least in the beginning. But in the long term, I hope that the cost will be reduced, because people are, prevented from, diseases, and from more complex diseases, which is more expensive. And I think one thing that, as you mentioned also, it is the first time we have a surplus, and we estimated that surplus actually can be sustained at least when we are not increasing the premium, the contribution. it can last, at least in my calculation and the actuarial calculation, can be reached in the year 2026, Julie. And of course, now we are facing from pandemic COVID-19 to endemic. So when it is endemic, then it is responsibility not the Ministry of Health or the government, but to BPJS Kesehatan. So do you have any suggestion or anticipation that BPJS should have to anticipate if pandemic COVID-19 change to endemic, and now in the endemic situation, BPJS Kesehatan who responsible for the whole thing, not only the payment, but how people who are infected and should be treated, and access to healthcare and increasing the quality. So do you have any suggestion for anticipation?
Sure, Pa. Let me start by actually acknowledging and appreciating that the infrastructure built by BPJS and JKN was one of our strong points during the pandemic. So it may not be recognized that easily, but the fact that we had a lot of hospitals contracted and with a payment system and a claim system ready, and an institution like BPJS available to process claims, is not there in every country, particularly in the middle income country setting. So even though the government was paying for the treatment for COVID-19 patients from outside JKN, it was exactly using the same infrastructure that had been built over the years by JKN.
You're right.
Many countries struggled to be able to purchase services from outside the public hospitals because there was no claim system, no way of regularly paying, no payer entity. This is not common. Sitting in Indonesia, we don't recognize how big an infrastructure this was that was able to create, in a moment of need, the infrastructure with which the government could provide, and provide not just services but free services to every COVID patient. I think it was a lot of credit to the government for paying for them, but also credit to everybody who worked to build the infrastructure that made this possible. And I think that is something that we don't recognize, but was an indirect contribution of JKN.
I just realized that this important of the infrastructure. It's not every country has that. Just when listening for your explanation.
Exactly, Pa. And I think now we have to think creatively on how we as a payer institution can create the infrastructure that can be ready for any future outbreak, any future pandemic, but at the same time is a what I should say, a no regret investment that we will be able to use even to improve access. So for example, if we start looking at more digital ways of running our business, so to say, finding how remote areas can be served through digital technology and through maybe innovative ways of delivering services where it has been difficult, not only will that improve access and equity for those remote areas and also able to monitor quality better, it will create resilience. Because if something happens to my face-to-face interaction, then this digital infrastructure for primary care particularly will be able to take care of a lot of the consultation. We saw that JKN-KIS issued the telemedicine regulation during COVID, and that was very helpful for people who were in Isoman. So those are the kind of things where this infrastructure can be now deepened and thought through. And again, I think that with the size and capacity, JKN and BPJSK would be a very important contributor in the future as well.
Right. Thank you for your, just remind us that the infrastructure actually is very important, and we are lucky because we have it already.
Yes,
and of course, for the anticipation, if the subvariant of COVID, or like BA4, BA5, B1, 2, 1, and many things. And of course, now we are facing hepatitis, acute hepatitis. And we call it sometimes, because it is like mysterious, then we call it mysterious hepatitis. And maybe mysterious also how to pay it.
Yeah.
And of course that even in Belgium now, the they are have anticipation and quarantine for 21 days for those who are presumable infected with the what you call the measles of the monkey from Africa. And of course, there are many emerging diseases that we have to anticipate on that. I think before we close, maybe, you know, we would like to ask you how actually the leadership and strategic vision will influence the success of the operational of BPJS or social security in health.
It's not an easy question, Pa, but let me try. I think a lot of strong minds and very able leaders have been thinking about this. So maybe I'm just repeating what you already know. But I think part of what we are also talking about in this conversation, the importance of investing in primary care and reducing the need to be in a hospital is a much better way of paying for healthcare and is much more feasible in a single payer setting than is possible in any other setting. So I really feel that we have a whole range of effort to do in how we strengthen primary care, and that would be a very big lesson for other countries also, to see how Indonesia delivers on that expectation. I think the second important frontier is going to be quality of care. How do we leverage this vast $8 billion of spending to also meaningfully transform the quality of care? And I think we are in a very good shape to do so. Some of the things that we have started working with JKN-KIS and with BPJSK as Bank Dunia include work on clinical pathways.
It is very important.
It's very, very important. So if we can have standardized clinical pathways and also build capacity at all levels of care in being able to understand and use clinical pathways, we'll be able to improve competencies, skills, and quality of care, and thereby lead to much better outcomes. And those can be, of course, part of the JKN payment system that can then reward for compliance with the quality. I think that's another very interesting frontier. The third that we just discussed also is digital health. The world is now at a point where we may want to leverage technology in a much greater way. The fact that we are having a podcast is a boon of technology, right? And so we have now the ability to use technology in healthcare much more, and the pandemic has taught us that this can be very meaningful if we have done it well, and it can add to our primary care infrastructure. It can add to our primary care being better linked to referral care as well. So I think that would be another good frontier to think. And all of this will need to be kind of intertwined in continuously refining our provider payment system and how we create incentive mechanisms to achieve policy objectives. So we are there with you to help as much as possible. And I think we have a very able leadership both at BPJSK and at JKN-KIS that is really doing its all its best to achieve this. So we are hoping that jointly we can work on this and make the task of second generation reforms a bit easier, but also take these lessons to the rest of the world through the JLN and through other modalities.
Right.
Very much looking forward to it.
Thank you. But just before closing, I think your suggestion, for example, for digitalization, it is really important, and we are on that way. So, for example, now we are developing what we call it online queuing system. So usually people are, forced to come to the hospital and wait for 5 to 6 hours. But now they are from their home. they can just using mobile, JKN, they can queue, and they know what time, and queue number, for example, number 2, number 3, so they will know it. And then of course that now we are also having the, to detect the fraud using the digitalization, automatization, and also for the claim, we have operationalization, interoperability with the Ministry of Health for claim, for example, COVID claim. So the process, we are interoperability of the digital system. We developed that, and also now, the teleconsultation, for example, already more than 12 million teleconsultations, already recorded. And of course, when you are trying to say the payment system to increase the performance in primary healthcare, we now developing what we call it performance-based capitation.
Kapitasi berbasis kinerja.
Berbasis, you're right. And also now we are trying in the 60 places for piloting telemedicine. So we hope that maybe next month or next 2 months will be launched the pilot of the telemedicine by President. We hope that this will be occur. Okay, Samuel, thank you very much for your very nice explanation, and very, interesting. And, I just realized that actually we are, on the right track, and some achievement like infrastructure, as you mentioned, is really important. Thank you.
Thank you very, very much. It was a
You're
pleasure
welcome.
being here, Pagufran. Thank you very much.
Thank you, Samuel. Nice to meet you and to discuss with you.
Thank
Thank
you.
you.